about being in a hospital or any medical setting? Who is the one that has the most patient interaction and cares for you before doctors comes to visit? A nurse. But what is a nurse? The Merriam-Webster Dictionary will tell you that nurses are licensed healthcare professionals who practice independently or are supervised by a physician, surgeon, or dentist, and who is skilled in promoting and maintaining health. But what does the real definition of a nurse mean? I think that most people are curious about who nurses really are. The definition of a nurse barely scratches the surface. From Brianna Flavin's article on Ramsey College's website, she found that the Bureau of Labor Statistics indicates that there are more nurses in healthcare than any other kind of profession, almost twice as many. I've chosen that my career is to be a nurse, and I've discovered who nurses are, and I can tell you about it. So, today I'm going to inform you about who nurses are, how artificial intelligence will affect my career in the future, and what role a nurse is expected to play from each and every shift. So, I started with the dictionary definition of a nurse previously, but what is the inside scoop on that? From nurses.org, an article written by nurse Sean Dent gives us some inside scoop on who nurses are and who they are not. Dent writes that everything from the scrubs nurses wear to the actual function and role they play at bedside is mostly misrepresented in movies and on television. Dent writes that nurses are real life, high-functioning and independent, critically thinking healthcare providers who are treated as colleagues, not as servants or handmaidens. A valid opinion of Dent's is that it takes heart to do this job. Nurses are challenged physically and mentally while being expected to have a firm grasp on their emotions. Nurses see the human condition at its worst and most vulnerable moments. From the Bureau of Labor Statistics website, employment of registered nurses is projected to grow 15% from 2016 to 2026. This is much faster than other occupations. While the demand for nurses is increasing, the number of new nurses has also increased in recent years, creating competition for jobs. Specifically, my career is to be a registered nurse with a Bachelor in Science degree in nursing. And generally, nurses with this level of education will have better job opportunities than those without. When researching about artificial intelligence and its rising use in patient care, I found an article all about this subject and some interesting information about an event held on this topic with some people who are the faces of the nursing world. What I found through research is that AI will not be able to replace nurses. Nurses may be concerned that they could one day be replaced by a robot, but the panelists deny this. American Nurses Association, Dr. Bonnie Clipper stressed that nurses will learn to incorporate AI into their practice, but it will not replace the human factor. Only nurses can provide hands-on patient care. And although innovators are still in the early phases of innovation and application, artificial intelligence is the effort to make machines think and act like humans. Computers are able to recognize images and sounds and then make decisions based on them. And with this advance in technology, it gives nurses more time with patients. An example is saving time by artificial intelligence completing a bladder scan or vein finding, lending nurses more time for other care needs. And while AI can help clinicians make more informed decisions for patients, there is widespread recognition that AI integration in nursing will always be a machine plus man formula. And just as Nico Paguliotis of Equinus said, the clinician will always have the last word. From this article, the panel agreed that companies like Equinus and organizations like the American Nurses Association will always have to engage with the nursing community in order to develop intelligent tools that meet and exceed today's needs in hospitals. It is almost impossible to encompass a nurse's role in just one job title. Shante Carter, an author featured in Brianna Flavin's article on nursing, says, "Nurses are the heartbeat of healthcare." She goes on to say that nurses are the faces that patients come to know and rely on. But what is the real responsibility of a nurse? While doing research, I discovered that a nurse can be described as an educator, a counselor, a chemical catalyst, an advocate, and even a confidant. These are all the different roles a nurse may be required to play each and every shift. A nurse is an educator in the sense of being able to explain and teach patients and families about their loved one's diagnosis. They're able to show how the patients should care for themselves. A nurse must often play the role of a counselor. A nurse is always at a patient's side to answer questions and to listen, acting as an ambassador for their patients. Carter says that sometimes even the simple task of holding a patient's hand for reassurance is an example of the kindness and empathetic characteristics a nurse must encompass. And aside from being a mediator between the patient and the doctor, nurses acquire so much medical knowledge and are involved in very acute tasks. A chemical catalyst is a good word to describe a nurse as. Nurses work as closely with patients as one can get, and many nurses have specific specialties that are critical to the healthcare system, such as a nurse anesthetist. They are in charge of administering powerful drugs to patients and are very involved in every breath and heartbeat that a patient makes. And because the nurse spends the most time with patients, they're the most familiar with their conditions and are expected to step in on behalf of their patients when medical plans are being discussed. And this is a way that a nurse advocates for their patients. It pays off to have so much medical knowledge and is very helpful on behalf of the patient when their nurse can spend enough time with them to fully understand their condition. And privacy of the patient is always of the utmost importance when it comes to nursing. Nurses must always adhere to upholding confidentiality and privacy laws, even though it is hard sometimes. Nurses know that when privacy is broken, trust is lost. Being able to encompass all of these roles and more truly proves that nurses are the glue that keeps the healthcare system together. So today, I have informed you about my future career. You now know who nurses are, how AI will affect the nursing career in the future, and what roles a nurse is expected to play from shift to shift. So now that you have been informed all about the nursing career, I hope you are no longer curious about the nursing field, because as stated before, nurses are the heartbeat of healthcare.